You. Hey everyone, happy January Monday to you. Hope everyone had a good holiday and a good new year. So I'm going to share my slides, but I am a social work faculty in the Department of Behavioral Medicine and Psychiatry, and I'm going to be talking today about using a family systems perspective as we think about the clients that we're working with, whether or not we can actually involve family in their treatment. So this is kind of a way to conceptualize what's going on with a person. We call it case conceptualization. And sometimes we can invite family in if we're thinking in this way, if that's logistically possible and with the patient's permission. And I'll talk a little bit about how that can really enhance treatment. Let's say okay to that. All right, can everyone see these slides? Okay. So just a few objectives. We're going to talk about how case conceptualization from a family systems perspective can help in working with our clients. We'll briefly do an overview of family systems theory, just as a review for many of you, and talk about the tools for assessing someone's family system, whether or not their family member is present. And I think there's 7 or 8 tools that are actually really helpful in capturing some of that data in often a graphic form, the classic one being a genogram that some of you may be familiar with. I'm a very visual person, so these kinds of tools can, for me, be really helpful condensing information all in one place that doesn't involve a whole bunch of reading, but is really, you can grasp it just by looking at it. And we'll talk about the benefits of including family members in treatment, whether literally or in this kind of way of conceptualizing someone's situation. We will go over the evidence-based interventions, which we've done in some previous echoes, so I just like to include those as a review. And then I have some case examples that have been adapted from folks I have worked with over the years. But if anybody has like an impromptu case as we're talking about some of these concepts that you want to throw out there, we always welcome other people to do it. It doesn't have to be in the structured format of submitting a case. We can just talk about a case in real time. All right, so just to review what I'm talking about in terms of case conceptualization, what is it? So this is case conceptualization really is a concept that grows out of CBT, and it's considered a competency. So when we think about the things that we get tested on for a licensure, it is a competency. How do we integrate all of the information that a client tells us to get an understanding of what's going on with them? And so it's a strategy for obtaining and organizing that information. It can help therapists and other providers identify strengths and challenges that the patient may have, maybe challenges that are born out of their family of origin and the experiences they had growing up as a child. Sometimes that's where some of those challenges come from. And it helps us really see a patient in context, not just the person that we have in our room with us that we see once a week or once a month or however often, but like they have this whole context in which they function in between our sessions and in which they evolved in terms of their personality formation and social learning. So it kind of, it grounds it in that where has this person been in their life up until now when they arrive in our office? Where are they now in their growth and development and skill building? And where do they actually want to go? And you can literally ask, these questions of people, but these are the kinds of questions that case conceptualization answers. These are the components, and there are a lot of components to case conceptualization. We might go over this in an initial intake that we have with a patient, or as I often remind my students, you may not gather all of this information in the first session. This is an ongoing process. So we do this over the course of treatment. We may not gather all of the information about their psychosocial history in the first session, but we add to it as we go along the way. And then our case conceptualization adjusts and changes as we gather more information. It's also kind of an engagement tool, especially if we can convey to clients and patients, like, they are the expert on themselves. We want to better understand them, and they need to teach us some of that so that we can help them. We don't know everything they've been through. Only they know that. So approaching it with curiosity rather than, from a perspective of I'm the expert and I'm going to tell you, how to fix your life, which I don't think anybody is doing these days, but that used to be sometimes the way that things were approached. So just a review of family systems theory, and this is informed by Bronfenbrenner's ecological theory. One of the primary tenets is that the family system is made up of different parts, and that family system, which is like the microsystem in that visual, is embedded in a community, a culture, and a nation, and a world or a universe. And so there are these different embedded circles in which patients' lives have context. Families are like organisms, and they strive for balance and self-regulation. So when we think about substance use disorders, the concepts of enabling often figure into this idea of balance and self-regulation. Enabling is a behavior that family members often engage in to try and achieve some kind of balance in the system. However, as we know, when people transition from active use into recovery, that is a very unbalancing experience, and that's often what people need to go through in order to facilitate change. But the family system sometimes can resist. I just had a client say to me this morning who is working on setting boundaries with her family. She basically said, they don't want me to change. They want me to stay the same. And they are pushing back when I set boundaries, which are indicative of the change that she's trying to establish. Families have subsystems. So an example of a subsystem is, the parental subsystem or the child subsystem. There's generations when we think about structural family therapy, the grandparent generation, the parent generation, and the child generation. And when there's sometimes alliances across generation, but most often in a structural family system model, we want to see alliances within the subsystem rather than a whole bunch across subsystems. Families have boundaries. Sometimes families have very rigid boundaries. These are often families with a lot of secrets. So when you think of substance use disorders and secrets, that's pretty common. Sometimes families have really fluid boundaries or loose boundaries where everybody's business is everyone's business, and there are no kind of barriers to information or access to information. And that can be problematic because there's certain things that say children don't necessarily need exposure to that adults should be talking about out of range of children's ears. And that doesn't always happen. Families have rules and rituals and roles. And we'll talk a little bit about those. Those often have a cultural context. So it's important for us to know how the individual defines their family culture, if there's ethnicity, race, or heritage involved in that. Sometimes we can tell if it's a person of color, we can tell that they might have a culture that is one that's different than, say, mine. Other times, if someone's Jewish, I won't be able to know that unless I ask questions about their culture. So there's just another little bit of a visual of that, these ecosystems. So the individual is kind of right in the middle, with the microsystem being their family, school, church, often things that people are interacting with on a daily basis. And then people from social work school will be familiar with these, like the mesosystem, the ecosystem, and the macrosystem. One of the things that I've been thinking about recently, because it's been in the news, is the way that local and national cultural awareness and humility is important. When I think of the humility part, I think about not assuming that we know, just because we may know that a person is from a certain culture. So we know, that someone is Native American, but we don't necessarily know what that says about their experience. There are many different Native American tribes, regional differences, and then what that person's experience may be growing up on a reservation or growing up in the general community would be very different. So asking questions about people's experiences and not assuming that we know. We also need to make sure we are recommending or talking about change that is consistent with people's cultures. Because if we're asking them to make changes that are really run contrary to their cultural values, that will create almost like a kind of like, that'll be a barrier to change, and people can have a lot of mixed emotions and ambivalence about making a change that, say, their family or their culture would say is wrong to make. So we have to ask questions about those things. All right, so according to family systems, this is sort of family systems in a nutshell. A person's functioning today is directly related to their place in the family system, their place historically, as well as their place currently. How, their relationships to those family members now and growing up. The family system have their own characteristics, rules, communication patterns, power, and structure. I like to tell a story, like growing up in our house, my dad had a chair, and it was well known that nobody sat in his chair, and we as like little kids would touch the chair and run away. Like it was a chair that nobody else got into, and if you got into that chair, you were in big trouble, especially if he was in the house. Nobody ever laid out that rule for us. We just intuited it, and we knew from his behavior and the behavior from his spouse that this was his place, and we were not to go in it. So just an example of kind of family rules that are often unspoken, not written down, but everybody knows, and there are consequences if you violate them. Interactions are bi-directional. So this is like one of the tenets that it's not just, patients will sometimes come in and tell us, this person's doing this to me, this person is causing me to feel a certain way, and really helping clients. And I see this as giving clients their power back when people get into a victim role. Like, where is your power in this interaction, in this relationship? Because relationships are by definition bi-directional. And the family members are interdependent. Even if people have cut off from family members, they are often still being influenced by those historical relationships, even if they don't have any current interaction with them, which often people discount the influence that even cut off relationships can have. Relationship problems is a kind of understanding in family systems theory. Relationship problems are caused by pathological communication and feedback loops, and people would have to define what that is, and how family members respond to the behavior of another can encourage like a positive feedback loop or retain the status quo, assuming that it's not a healthy form of communication. And I'll highlight this in one of the cases that we talk about. So for anyone who's heard of Bowen, Murray Bowen was a famous family therapist, and probably one of the family therapists that I think has some really helpful concepts. He has these 8 concepts. And if you're interested in, I'm not going to go into them in great detail. If you're more interested in them, the website is down in the corner there, thebowencenter.org, goes into much more detail about each of these concepts and even has some videos illustrating them. But the concepts that inform us thinking about like those 3 questions, where did the person come from? Where are they now? Where do they want to go? Kind of how did they end up in the situation they're in interpersonally or psychologically, can often be explored through taking a look at some of these things. So triangles. The reason that triangles emerge is when two people have a relationship, it can be very intense. And if it's very intense in a positive way, that's great. There's no problems. But when there is conflict, often a third person gets drawn into that relationship as a way to diffuse the energy related to conflict. Kind of the classic one is, parents are fighting and disagreeing about whatever they're disagreeing about, and it's a threat to the relationship, so they draw in a child or even an in-law into that, or the in-law voluntarily steps in to diffuse that conflict, or the child voluntarily steps in to diffuse that conflict in an effort to balance the system, because it's threatening when parents are fighting. So sometimes a third person gets drawn into a relationship. And with repetition, it can be problematic when that gets into like a rigid interaction. Differentiation of self. I think of this really as what we think about the concept of boundaries. So when families have poor boundaries, or very diffuse boundaries, people are in everybody's business, and often people don't have a strong sense of self. And so differentiation of self is connected to that ability to hold on to your sense of self, even when other people disagree with you, even when other people are criticizing you, and not lose your core values. Nuclear family emotional process. There are 4 relationship patterns that this refers to. These are like classic things that go wrong in families. So marital conflict, dysfunction in a parent, for an example, like mental health disorder and/or substance use disorder, dysfunction in a child. So the focus is on the behavioral problems of the child, or emotional distance, where people really don't communicate well and aren't talking to each other. So those are kind of the four categories of things that can go wrong in families, according to Murray Bowen, and many things fall within those categories. And then the remaining concepts are family projection process, and this is where parents project their own fears onto their child. This can often happen. We see this a lot in parents, where I see it a lot in moms, where they have had the experience of sexual abuse or sexual assault, either as a child or a young adult, and they are terrified to allow their child to be with anyone other than themselves. So I'm not just talking about like a normal fear of wanting to vet your babysitter, but they are terrified of letting anyone supervise their child, for fear that they will be assaulted in some way. And so the kid feels that fear, whether it's articulated in words or not, and that can sometimes have a pathologizing effect on the child. Multi-generational transmission process. So again, patterns of interaction are handed down generationally along family lore. So the stories that families tell. Certainly we see this in Jewish families, when I think it's, however many generations have been removed from the Holocaust, but the stories are told, and it can affect, generations after, with regard to fear. I had mentioned my emotional cutoff. That's, when people just cut off as a solution to manage conflict. And yet what we see, and many of you guys have worked with clients who cut off from family members, doesn't actually resolve the conflict. And it's not that cutoffs are always a bad idea. It's just that it doesn't serve to resolve. Additional work has to be done to resolve a cutoff, and it makes it harder for direct healing and repair. But there are other ways to do that, like through role play. Sibling position is a factor. So there's been not a lot of recent work. Walter Thoman is really, in the 60s, developed the idea that different siblings, if you were oldest, youngest, middle child, have different experiences of their families growing up because of their sibling position, and because of the roles that they take on in that position. And then societal emotional process is really that family in context of the culture, say, or the political climate as an example. All right, so those are all the concepts. Are people familiar with family roles? These hopefully are familiar to some of you. Virginia Satir and later Claudia Black in the specific context of families with substance use disorder talked about some of these roles. So I run a multifamily group as part of our IOP program. And one of our sessions is helping people identify if these roles resonate with them and who they identify in their family as having these different roles. Family hero is, the golden child, or it can also be a parent. The parent who takes care of everything, is the most reliable one, appears to be the highest achieving, externally achieving one, and the one that the family looks to for leadership. The placater or the people pleaser is the one who's trying to keep the peace usually. It's that was my role in my family growing up. So I was from a divorced family and I was always trying to balance, my mother would say this thing, my father would say this other thing, and I would try and kind of run interference between them and still not take sides, appear to be impartial. And this is also sometimes in families with substance use disorder, the enabler. So this can also be an adult in the family, and in an effort to keep the peace, the parent is enabling, say, an adult child with a substance use disorder. The scapegoat. So when we think of substance use disorders, that can sometimes be the person with the substance use disorder. Sometimes it's not. So it can really vary. The lost child is the kid who often really just withdraws as a strategy for coping. Often these kids are spending a lot of time alone, spending a lot of time reading, isolated from friends and family, and develop pretty rich fantasy worlds that help them cope with whatever difficulties happening in the family. And then the mascot. So this is the clown, the person who tries to diffuse conflict or negativity with joking around or making a scene, or being disruptive in some way. And so asking your client, like, if they identify with any of those, especially when we work with people in groups, these roles will present themselves in groups, because often in a therapy group, people carry into those therapy groups some of the behaviors that they might engage in their family group. And we can generally have a sense of whether someone was a mascot or a family hero in the groups that we run for patients. So always good to remember that people have environmental risk factors based on their family of origin. So when we think of the case conceptualization, what are some of those risk factors? These are generally, the ones that we think of related to growing up. So what was it like to grow up in your family? That's a question that can elicit some of these risk factors. And then protective factors. So school and what people's experiences were like in school can be a protective factor. And did they do well in school? Did they like school? Was school a respite? I worked with a client who, she says she was involved in all kinds of extracurricular activities. It didn't matter if she liked doing them or not. She just wanted to be out of the house as much as possible because her father was an active alcoholic. And so she was kind of a hero child and looked like that from the outside. But in fact, it was her strategy for coping, which was to be involved in all and any extracurricular activities. All right, so I'm going to go over some of these tools specific to assessing the family system. And again, the thing I like about these tools is you do not need the family members present. Sometimes people are, especially adolescents, do not want their family, do not want to do family therapy, don't want their families involved in their sessions. Not that is always contraindicated. Sometimes it's helpful, but this is a way to assess that family information without necessarily having a family member present. So everyone's probably familiar with genograms. Anyone who remembers Friends, this is one I found on the internet looking at Ross Geller and his genogram, which is kind of interesting because you have many people are familiar with his character on Friends, but this is what a pretty detailed genogram looking at 3 generations can look like. So the lines connecting people are indicative of the kind of relationship they have. So green lines, two solid green lines are a strong relationship. The jagged one is conflict, and the dotted one is usually representative of kind of a distant relationship or some complexity going on there. Many things that we can identify and track. We can often look at substance use disorders, mental health disorders, and you can indicate that by shading one of the squares or the circles a certain shade, and then you can visually see, wow, all of these people have a diagnosed mental illness, or all of these people have a significant substance use disorder, and get a visual picture very quickly. There are often patterns that just jump out when you do visual representations of people's families that are just not as clear when you're talking with someone about their family. So I love the genogram as a way both to gather information, store it efficiently in a small space, like on one piece of paper, and also it can highlight patterns that may not be apparent when we first begin to talk with a patient. Another is more of like an assessment. So this is the APGAR, which stands for Adaptation, Partnership, Growth, Affection, and Resolve. It's super simple to administer. It's just, a mini Likert scale looking at these different areas, and the scorings there at the top to assess for family function or dysfunction. The eco map, which I also like, this is a little bit hard to read, but I have another example of it later. Again, a visual representation. Often you'll get a sense of isolation in a patient because this is looking at who's close to who. So usually people put themselves in there, and then with how close they put the other squares or circles to them indicates how close the relationship is. And then you can also add if there's any conflict, who's on the inside circle of the family. So we think about those boundaries and who's on the outside, or you can put the social, recreational, school, the other kinds of things that impact the family that can be resources or can be problematic. So it's like mapping an ecosystem of the family and their current resources or lack thereof. So you can do it with just people, or you can do it with people and systems. This is another assessment called the SCREAM, standing for Social, Cultural, Religion, Economic, Education, Medical. That's what SCREAM stands for. And assessing for kind of strengths and weaknesses. This calls it resources or pathology. And again, it's family-based versus based on the individual. Another one that we use with adults as well as children is draw your family. When we were seeing folks in person, we would often do this in our family group, drawing your family in active addiction, and now what does that look like in recovery, or what do you hope it to look like in recovery, so that people can generate some hope about what that change could result in. And this is just a depiction of some kids drawing their families. You can certainly see, I imagine this is like what they wish their family was and what it actually is. And this is drawn by a child. Get a lot of information that doesn't involve talking. And then the family timeline. And so this is one of the things I've used to work with a patient over time. So there's not something you would do in one session. You would kind of pull it out and people would add to it as significant life events come up in the therapy. You can jot these down and get a sense of when they occurred. Sometimes you can gather information about how that may have influenced the development or the progression of their substance use disorder. And the benefits, families have knowledge about each other that we don't have. And so including family members can be really interesting. Even just observing the interaction, I usually get a ton of information without asking a single question, just based on how they interact with each other in a session. Who takes charge, who says what, who's really quiet, who's looking at the floor, who sits next to who, all of those nonverbals. Families have leverage to influence. So when we think about trying to motivate someone for recovery and discontinuing substance use, there's often leverage in the family that we as providers do not have in terms of consequences and motivation. It's a way to prevent substance use disorders from continuing generationally. We can harness the family's strengths. Sometimes family members do things inadvertently that really work against our efforts in recovery. So we recommend certainly in the beginning that there not be any substance use in the home where the person is living, and that it's not always the case. And so involving family members in that conversation as to why and assessing for any difficulties in doing that can be really helpful. Family members often are expressing they're not supporting the person in a way that feels supportive. They think they're being supportive, but the person in recovery is like, that is super not helpful. But there's too much conflict in the relationship for the patient to communicate that. So helping families have that conversation so that they can transmit that information and come up with more supportive ways of being supportive can also be helpful. Promoting healing. And then accountability. So family members can hold their loved ones accountable in ways that providers can't. So there are some challenges. Again, we have like a built-in multifamily group as part of our IOP, and we have many clients who are like, I'm not bringing my family member. And when you unpack that, like, why not? It's often fear, because we're meeting virtually, so there's not a transportation issue, but transportation can be an issue if you're meeting in person. They don't know what their family member is going to say. They're afraid of what their family member is going to say. They're afraid of what other group members are going to say in front of their family, concerns about confidentiality. And so talking through some of those fears to encourage them to include family can certainly be done. Lack of training by the therapist. So there's sometimes therapist reluctance to bring in family because of a lack of training. And so there are lots of different ways to get trained. Actually, the craft model is pretty easy to get trained in and not very expensive. And that's, a model that's out there where you can work with the family with or without the client present. And using evidence-based treatments is important. So I'm not going to go through these for the sake of time, but these will be in the slides when you get sent them. And so these are just the evidence-based treatments for family therapy interventions to treat substance use disorders. And then I mentioned the craft model. The craft model is very behavioral. So family members are taught communication skills, like giving them a very clear model, and then practice through role play, going out and practicing with their loved one, coming back and processing how that worked, and then tweaking. As I said before, helping family members understand what is support, what does that look like, what you think is supportive, the person with a substance use disorder may or may not be experiencing as support, so checking in about that. Detachment with love skills. So this is really an Al-Anon concept, which is helping family members focus more on their own wellness as opposed to trying to fix their loved one. And CRAFT does this as well, helping folks get out of their loved one's business, and supporting them rather than trying to fix and check and becoming sick themselves through some of the enabling, the codependence that can occur. And then encourage self-care and self-focus. So just to mention, contraindications to involving family would be active substance use, severe, or moderate, depending on kind of the dynamic in the family. You would not involve someone who's struggling with their own substance use disorder unless it was in an effort to support them to get into treatment. So that would be kind of running that by someone with some experience, and domestic violence, because anytime you do a family intervention, it can actually increase some of the stress, and we don't want to precipitate a likelihood of domestic violence. So this is just the communication, positive communication in the CRAFT model. These are the 7 characteristics of positive communication that they talk about. And these are some detachment skills. One of my favorite ones that we talk to families about are not creating a crisis, but not preventing one if that is the natural course of events. So some of these concepts can be helpful to share with family members. And then resources, all kinds of online resources and peer support for family members. We always encourage that as well. So before I get into the cases, any comments, questions, thoughts? Anybody have any family treatment examples, families you're working with, or anyone this might be helpful to use with?